More hospitals continue to operate under pressure. The latest to sound out an alert is Markham Stouffeville. It has sent out a warning asking people to consider other alternatives than coming to its emergency room.
We've not seen the pressures this extreme or the gaps this large.
Markham Stouffeville Hospital put out this tweet warning of longer than expected wait times, asking patients to consider alternate options if it's not an emergency. Dr. Andrew Arcand, the chief of emergency medicine, explained the situation has been caused by an unexpected surge in patients. The hospital had to scramble to find beds and then faced a lack of nurses, something healthcare workers have been warning is a major problem.
The relief doesn't appear as imminent as we would like or need.
Another ER doctor is also speaking out about the pressures on the system.
We have had problems with hallway medicine in the past. The real big difference right now is that the staff have become so shorthanded.
Ontario hospitals have been under extreme strain for years, but COVID has amplified the problems. Burnt-out nurses have been leaving the profession, angry the government capped salary increases to 1%.
We have to retain nurses. Letting nurses go because they're disgruntled and burnt out and don't feel valued by the government is not the answer to anybody's problem. And I don't care how many nurses you hire. If you hired every single one a replacement tomorrow, it's still going to take them at least a year to get as proficient as the nurses leaving now. The staff have become so shorthanded that we're having to close emergency departments altogether or restrict certain areas of emergency departments like fast-track areas or community settings for urgent care centers. I've never seen that to this degree.
CityNews has been given the data on ER closures since the week of June 27th to August 9th from the Ministry of Health. Over that 7-week period, there have been a total of 40 overnight closures and 4 full-day closures. They have all been at 13 hospitals, the vast majority in rural communities like Perth. This week, the ministry projects there will be 5 overnight closures.
I don't see this getting better, certainly not before the fall.
Ontario's health minister yesterday announced measures to try and ease the strain on hospitals, including expanding a program that allows paramedics to treat people on scene rather than go to an ER, and fast-tracking accreditation for foreign-trained nurses. None of that, however, will be making an immediate difference.